According to Hockey Quebec, every year 94,000 young, aspiring hockey players lace their skates with dreams of one day making it to the NHL. At some point during the season, many of these same players will be sidelined due to concussions.
I play a lot of sports, especially hockey. I'm a good hockey player.
During the 2010-2011 hockey season, Lucas Romano, a competitive hockey player, suffered 2 concussions.
Well, when I got hit the second time, I knew it was a concussion because I knew what it felt like the first time, so I knew it was a concussion.
Lucas's second concussion happened during a tournament where an opposing player hit him in the head. Lucas lost consciousness and had little memory of the event.
I was scared. I didn't know what to do.
It's happened to him before. It happens during all the hockey games, but when it happens to your son and you see him on the ice, I mean, he was unconscious maybe for about 5 to 6 seconds, but it's a long 6 seconds. He got up after that, he went on the bench, and you knew there was something wrong. They were checking him out, so it scares you. It scares you because you're there to enjoy a game, and you know, all the injuries that happen during these games, it's a scary feeling as a parent.
I just remember going onto the ice to do the warm-up, and after the hit, I remember getting into the ambulance. Then I blacked out. Then after I got into the hospital, they did a CT scan. The doctor asked me questions.
A concussion is a brain injury. It results from a blow to the head, face, neck, or body. Wearing a helmet will lessen the impact and prevent a severe brain trauma, but does not entirely prevent a concussion. This is because the brain is mobile within the skull and it can move from side to side during a fall or hit. Even though Lucas was wearing a helmet, the hit was hard enough to knock him unconscious. Loss of consciousness does not always happen with a concussion. A concussion results in a disturbance of brain function. The signs and symptoms of a concussion are broad and vary with each person.
Like they said, I was a bit dozy, drowsy, and dizzy. I had a headache, I was dizzy, I didn't really know where I was, I forgot everything.
People who suffer from concussions may exhibit a number of different symptoms, including headache, nausea, vomiting, seeing stars or flashing lights, sensitivity to light and sound, ringing in the ears, double or blurry vision, poor coordination, impaired balance, feeling dazed and confused, irritability, drowsiness, dizziness, fatigability, difficulty tolerating motion. Following a concussion, patients need a period of physical and cognitive rest while they recover.
It was like home. I couldn't really do anything. I couldn't watch TV because the doctors told me I couldn't play video games. I couldn't really do sports. That really took up a lot of time. Since I couldn't do sports I was doing it 6 times a week. Now I was doing 0 for the whole week, which was hard. It was hard.
And in the first 5 minutes, we thought it was pretty severe. I mean, but you never realize the after effects, you know, that last couple of weeks.
When I got back to school, I had exams, and like I was really scared to do them because I had a hard time concentrating on like what the teacher was saying, what he was explaining. So then when I got to do the exams, I didn't pass my exams. Then the teachers asked me what happened, and I told them my head was really hurting. I couldn't really concentrate on what you were saying. And then they asked me what happened, and I told them my story. 2 weeks after my injury, I came to the Montreal Children's Hospital. I came into the concussion clinic. I met the physiotherapist and the neuropsychologist, and I was tested in both.
The Montreal Children's Hospital Trauma Center's mild traumatic brain injury program, with its innovative concussion clinic, sees about 500 patients each year. These patients will come to the hospital and be seen by physiotherapists, neuropsychologists, social workers, and other specialists in order to help with their rehabilitation.
Before coming to the hospital, I really thought, I was convinced that I was able to go back to sports. But when I got to the concussion clinic, they told me otherwise. They told me that I still wasn't ready to go back, and that I had to take more time to go back to sports and to school and everything. So they made me realize that. This experience made me realize that you can only go back to sports when you're 100% symptom-free, and because then if you go back with still like headaches or dizziness, and if you get another injury during your sport that you're playing, it can just make it even more worse and more severe, and you'll be out for even a longer time.
When you suspect a concussion, tell your coach or parents right away. Do not return to the game or practice. Never play through an injury. Seek medical attention as soon as possible. Your brain needs time to rest and recover. You should be symptom-free for at least 1 week before returning to any physical activity. And once symptom-free, you are ready to undergo a progressive return to physical activities. You are more likely to have a second concussion if you return to play while your brain is still recovering. Repeated concussions can result in long-term and in some cases permanent consequences. For more information regarding the management of concussions, please refer to the MCH Trauma website and concussion kit.
I realized the concussion affects your almost every aspect in life, and I realized that it's a serious brain injury, and like it gives you a hard time in school, in sports, in like almost everything in your everyday life. And you have to really take your time before doing all the stuff you do routinely.
The best form of treatment for a concussion is prevention. Preventing concussions takes a concerted effort from the players, parents, coaches, and officials.
The players have no respect for each other. I find that it's all about hitting. I mean, they're not even doing the sport as it should be. They don't even go for the puck. They just go for each other. They just want to put them out of, they want to put the player out of the game, and, that's it. Like, they want to be tough.
For an athlete, preventing concussions means fair play, which includes teamwork, sportsmanship, respecting the rules, and zero tolerance to violence, and being upfront about symptoms.
Coaches tell some kids that, you know what, you're in this team because we want you to hit. It's funny, as a parent, you know what, you want your son to succeed in everything that he does. So you know what, we tell them, yeah, listen to the coach, but sometimes...
Coaches also play a large role in concussion prevention. They should set a positive example for the players regarding respect and sportsmanship. Violence should never be tolerated. Canadian children look up to the professional NHL players, so even they play a role in concussion prevention. Their behavior on and off the ice is imitated by players across the country.
The NHL definitely has an impact on younger teens, in the sport, because they look up to them as, as their idols. They want to be like them,
I think that the NHL players have an impact on younger hockey players because every young hockey player's dream is to be in the NHL, so they want to do the same thing like the players so they can get to the NHL one day.
Finally, parents have a huge role to play. If parents react negatively to a penalty, so will their children. They need to stay positive, respect the rules, and set a positive example of sportsmanship for their children and teens. 2 years later, Lucas is still playing hockey, but he is more alert regarding concussion prevention after this difficult and challenging experience.